Now we are going to start Prime Minister's press conference. First of all, Prime Minister has opening remarks. Prime Minister, the floor is yours. Earlier today, novel coronavirus headquarter meeting was held. Saitama, Chiba, Kanagawa, and Osaka. We are going to issue the state of emergency to those prefectures, and Hokkaido, Ishikawa, Kyoto, Hyogo, and Fukuoka. For those prefectures, we are going to implement priority measures for the period from August 2nd to August 31st. This is the period for the measures. The state of emergency in Tokyo and Okinawa is also extended to August 31st. This is the decision that was made. Across Japan, the number of new cases is on the rise. Yesterday, nationwide, the number was more than 10,000. Today in Tokyo, number of new cases is 3,300. In metropolitan area and also in Kansai area, in many regions, the number of new cases are increasing. This is the rate that we have never experienced. This is how fast the infection is spreading. The major reason is pointed out to be the new variants, particularly Delta variant, and that is making a strong influence global world. Compared to the Alpha variant, its infectivity is 1.5 times stronger. In Tokyo, it accounts for 70%, more than 70% of the new cases. Nationwide, Delta variant is replacing the other strains, and there's a concern that infection is further spreading. On the other hand, when we look at the infection status, 73% of the elderly people have completed second dose of the vaccination. So there is an obvious different characteristic compared to the infection in the past. In Tokyo, the number of new cases who are older than 65 years or older, even though nationwide infection is spreading, the number is only 82 today. The percentage was 20% mark in April. Now it is down to 2%. With this development, people with severe symptoms are increasing. We can see the control of the number of people with severe symptoms in Tokyo. People who need ventilators compared to January is as half as it used to be. The utilization ratio for the hospital beds are about 20%. And number of deaths compared to January, we see the great decline. As we can see from these numbers, vaccination is really making a difference. However, still, there are the concerns that we have to have. One of them is infection among young people. It is spreading rapidly. In Tokyo, people who are younger than 30 years, in their 30s, are increasing, and it is more than 1,000 per day. And people who are infected, people in 40s and 50s, they are increasing. It is about 1.5 times compared to January. If number of infection doesn't stop, then number of people with severe symptoms will be increasing, and the hospital beds will be under strain. And with the increase of the number of new cases, public health centers hospitalization coordination is taking more time, and therefore more people who are recuperating at their homes. Given this situation, we continue the vaccination. At the same time, in each area, we take robust measures so that we can avoid medical preparedness being stretched. That is why we expanded the region for state of emergency and priority measures, and we also decided to extend those measures. This is something we have never experienced. This is the battle against the new infectious disease. For the past 1.5 years, we have asked people of Japan to give us a support. I would like to take this opportunity to appreciate the support that you have given to us. On the other hand, when people are refraining from going outside, there are the fatigue that people are feeling, particularly among young people. Some people say that COVID-19 is not something we should be afraid of. They want to prioritize their normal lives over preventive measures against the coronavirus. However, we want people to understand, because of the emergence of the Delta variant, situation is different. Even if you are young, you have a higher risk of developing severe symptoms, and you may suffer. And there are some people who are suffering from after effect after they are infected with the COVID-19. This is another request to the public of Japan. This is the request. So until the vaccination makes a greater effect, we want each one of the people to stay vigilant, to take thorough measures for the countermeasures against the virus, and please be careful when you do activities. Even though this is the new variant, Delta variant, the linchpin of the measures is the dining, when people tend to take off the masks. And the infection is spreading in workplace and the households, wearing the masks, washing hands, avoiding 3Cs. These are the basic measures against the COVID-19. Especially when you are having a conversation, please do wear mask. This is, once again, the request from the government. For dining and drinking establishments, we have been causing trouble for such a long time. We make efforts to pay the subsidy as soon as possible, and also in more simplified assessment, we pay the subsidy. So we are organizing an environment where businesses are willing to provide the support. At the same time, going forward, in each prefecture, there will be enhanced patrol activities for dining and drinking establishments so that the measures will be more effective. We will have a summer vacation. Please refrain from non-essential outings, and please refrain from moving around. If you have to go out, please move with the family members or people who usually spend time with. Even if you are going to other prefectures, please do take thorough measures, and please take tests. We want people to be careful as much as possible, and also drinking on the streets, meeting or dining with people who you do not usually meet, and the dining for the long time. These are the things we want people to avoid. After Olympic Games started, there are transportation restriction, remote working, and because of the support from people, the nightlife districts, the flow of people is actually declining. In order to further decline the flow of traffic, We want people to watch and support athletes through TV. This is the request.
The goal of fight against COVID-19 is to protect the life and health of the people. And what is needed for this is to make sure that we maintain the healthcare system in local areas. And the key, vaccination and effective therapeutic drug, so that a burden on the hospitals can be prevented. That is to prevent the increase in the patients with severe symptoms. In February, we have started the vaccination of the medical practitioners, and from April, we started vaccination for the elderly people at the age of 65 and years old and older. So strategically, we have been conducting vaccination. Fortunately, with the cooperation of many people nationwide, the vaccination is in the medical institutions 1.3 million doses per day and 200,000 doses per day in workplaces and universities, the pace which is higher than was expected. As a result, total vaccination together with workplace and universities vaccination is 90 million at the end of this month. Close to 80% of the elderly people will be completing the second dose of vaccination. Preventing cluster in the hospitals, and we have the prospect for completing vaccination for the elderly people. So the 40s, people in the 40s and 50s, which have high risk of infection, and also young generation where infection is spreading, will be focusing upon vaccination to this generation as well. In the local governments nationwide, we will be promptly showing how much of the vaccine can be supplied. Therefore, vaccination program can be implemented in a well-planned fashion. Today, for people in the 40s and higher, the AstraZeneca vaccine, which can be applied to them, was approved. 2 million doses is already secured by the government, and to the localities, municipalities which hope to receive them, will be supplying them promptly. In the latter half of August, the ratio of those people who have completed 2 doses will be more than 40% of the total population. And we'll be regaining their new normal lives, and we'll be making every possible effort to make that possible. Furthermore, we will be focusing upon providing appropriate information, right information, vaccination people, in order to protect health and to protect friends and family members. I'd like to ask the young people to cooperate for vaccination. Therapeutic drugs, there's a big progress. The patients with a moderate and mild symptoms, we do not have effective therapeutics, but reducing 70% of the risk of aggravation, epoch-making drug was approved on 19th of this month. Already, more than 2,000 medical institutions have already registered, and depending upon request, we will be delivering these drugs to the institutions. The government will be securing sufficient amount. We do have secured sufficient amount of neutralizing antibody drug, and we'll be actively providing and supplying these for the patients with underlying diseases to prevent the aggravation. And if the testing system will be established so that people can feel easy in being tested. As to the exit from the state of emergency, in addition to the progress of vaccination, we look at the people with severe symptoms and hospital bed and utilization ratio. We look at the burden and conduct analysis, and appropriate decisions will be made. In addition, toward the relaxation of the restrictions on economic activities, we will be showing the pathway. By the end of August, up until the end of August, we will make effort so that this will become the last time a state of emergency is declared, and we'll make all out efforts to implement the measures. I seek kind understanding and cooperation of the people of Japan.
Now we'll take the questions from the floor. Dr. Omi, please proceed to the podium. And some questions, if necessary, he will answer the questions. If you are pointed, please proceed to the microphone. Please state your affiliation and your name and ask your question. And I will ask Sato-san from Hokkaido newspaper to ask the question as a representative media outlet. This is Sato from Hokkaido newspaper. On 8th, you said that you are going to take proactive measures when you announced the state of emergency of Tokyo. However, number of infection is making a record highs. How do you see the responsibility that are lacking in the message from you to ask people to refrain from doing activities? You continue to say vaccine is effective. Maybe it is leading to the lack of people's lack of crisis. How and by when are you going to control the infection? Lastly, you said the premise of the Olympics are to protect lives and livelihood of the people. Do you think the lives and livelihood of the people are protected? Do you continue to hold Olympics and Paralympics as planned? The number of infections in Tokyo is increasing. The reason is said to be the rapid increase of Delta variant. Compared to Alpha strain, its infectivity rate is 1.5 times higher. Delta variant accounts for 70% of the infection in Tokyo. And experts said that nightlife district, they still have the high level of flow of people. It hasn't declined enough. Those dining and drinking establishments who decided to shorten the operation hours, we provide the subsidy as soon as possible, and we will focus on the patrol activities to the people of Japan. As I said earlier, vaccination is really the decisive factor, and we make utmost effort, and we need to make utmost effort for the vaccination. And you also asked about the Olympics. There are traffic control to Tokyo, and the higher price for Metropolitan Expressway, and also the restriction of the cargo ships to Tokyo Bay. There are a number of measures that are being taken, and remote working is another measure. And it is true that because of those measures, the flow of people have been declining. And in order to further control the infection, we encourage people to watch the games of Olympics and Paralympics on TV at their homes. As we do those measures, we would like to control the spread of the infection. And also, about analysis of infection and the outlook, I hand over to Dr. Omi to talk about that. About the infection going forward, today there was a decision around the state of emergency, and this is very rapid spread of the infection. How the society in Japan respond and face the infection. And we are in the greatest crisis ever amid this situation, how the society overall will face the crisis, and that will determine the development going forward. If the society and people overcome the crisis, vaccination rate is increasing day by day. So when we overcome this, if we make a little bit more of the further effort, then we can open the economic activities. So we started to see such an outlook. That being said, so the fire is flaring up. This fire has to be controlled as soon as possible. This is our focus. Once we pass that point, we will start to see the light at the end of the tunnel.
Next, Sugiyama-san from Fuji TV, please. Sugiyama from Fuji TV. I have a question to Prime Minister. Prime Minister, you have been saying that good results were seen in stopping serving alcohol, but thousands of eating and dining establishments are not reducing operating hours. How do you take a look at this? And you said that you're not stopping Tokyo Olympics because of the decrease in human traffic. Does that remain true? If vaccination is progressing and human traffic is decreasing, then some people say the infection will not be increasing so rapidly. What is your view on that? Firstly, reducing infection risks by in dining and drinking establishment is a key to reduce infections. And experts are pointing this out first and foremost. And now, infection at home is increasing because from outside homes, people are infected outside home and then infect family members. And the second is infection in workplace. So looking at this situation, now is a time that we should take measures strongly. The government, Tokyo Metropolitan Government, if it is Tokyo, and if it is Kanagawa Prefecture. So local governments, we have asked those which asked for cooperation, and the government needs to prepare an environment where cooperation is possible. Payment of subsidies in advance, and complicated procedures for application of subsidy. So we have to facilitate that and take measures. We will be working in that direction. With regards to Olympics and Paralympics, for instance, in holding the games vis-a-vis IOC, ordinarily 180,000 people, athletes, and stakeholders were scheduled to come to Japan. But we asked IOC to reduce the number of people coming to Japan to 1/3. And I visited the site myself, Haneda Airport, Narita Airport, when entering into the country. Make sure that there's no interaction or contact with Japanese people. Such measures are taken. So I don't think that these games are reasons for increase in infections. I would like to ask people to watch Olympics and the Paralympics on TV at home. Viewing rate is high now, so I'm sure that many people are watching the games on TV at home. Also, no spectators are allowed for the games, and from that perspective, I'm saying that about the situation of infection.
Now we take questions from other media. If you want to ask questions, please raise your hand, and If you are called, please proceed to the microphone. Mr. Shigeta from Nikkei newspaper. This is Shigeta from Nikkei newspaper. Let me ask about vaccine. You said that by the end of August, you want 40% of the people in Japan to complete 2 doses of the vaccination. About the process, people in 40s and 50s should be prioritized because they have higher risk. On the other hand, people in 20s and 30s should be vaccinated earlier. So there are different opinions. So what are the policy about vaccination? First of all, for those who wish to be vaccinated, should be vaccinated as soon as possible. This is the basic policy of the government. The elderly people who have a higher risk of the severe symptoms, by the end of July, we think we have achieved the target. Now the question is people in 40s and 50s. Among these people, infection is spreading, and also infection among young people is also increasing. Workplace vaccination, for instance, many of the people who do that is people in 40s and 50s. About the young people, the vaccination in universities have already started. So in a comprehensive perspective, we have to respond and continue vaccination. As I said earlier, vaccine of AstraZeneca, the 2 million doses have been secured and they will be available. And this is another measures, and it is important to implement a wide range of measures.
Nagami-san from Kobe Shimbun newspaper, please. Nagami from Kobe Shimbun. In spring, I have a question to Prime Minister. The fourth wave in spring in Hyogo and Osaka, serious strain on medical system. The patients who are not hospitalized and lost their lives without being hospitalized. With the expansion of infection, relatively controlled in terms of the patients with severe symptoms, but there is a concern as to the possible collapse of medical care system. How are you going to respond to this? Secondly, responsibility for increase in infection once again, and you did not respond to that question. So please respond to that question as well. First, what is happening? This wave that we are in, we have to contain that as promptly as possible. That is my responsibility. The first question, protecting the lives and the health of the people. That is a role of the government. And for that, necessary health care is to be provided to the people who need it. That is the basics. And Kobe and Osaka was discussed in that context at the beginning of this year when infection increased. And based upon the lessons learned in the prefectures, we have secured a large number of hospital beds and coordination amongst the institutions. For example, in Tokyo, from April onwards, 1,300 beds are newly secured. Also, as I mentioned earlier, the risk of developing severe symptoms is to be reduced by 70%. The first ever epoch-making therapeutic drug was developed and approved. So we are going to utilize this actively to protect the lives of the people. And more than anything else, Delta strain, high effectiveness is shown by vaccination. So we will be proceeding with vaccination program. That is extremely important.
Freelance, Egawa-san, please. This is Egawa, freelance. Then about vaccine, Prime Minister clarifies the specific targets. However, for the time being, until we have enough vaccines, people-to-people contact and people moving, they have to be declined. You mentioned declining the flow of people. What is the specific target and the approach? Because they are not presented. So to be more specific, how much traffic do you decrease, or how much people-to-people contact decrease in order to do that? What exactly are you going to do? You encouraged people to watch games on TV. Do you think that alone can achieve the target? And I also want to ask the same question to Dr. Omi. The Tokyo Games was decided, and in Tokyo, the majority of the venues are located in Tokyo. In order to prevent the people's traffic and its concentration has been considered, the reduction of the 30% of car traffic, and I think 60% reduction using remote working. In collaboration with Tokyo Metropolitan Government, we have been taking these measures. And with the spectators, we could also decrease 300,000 people in metropolitan area. So these measures were already put in place, and this is the measure that we are taking. So the concentration of the people, we had a number, and we can further decrease it, and actually we are doing that. Please refrain from asking questions from your seat. Well, you asked about the vaccine. No, the flow of people. Okay. There are multiple challenges. One of the important challenges is that people get used to COVID and state of emergency, and we have a Delta variant, we have a summer vacation, 4-day holidays, and we have Olympic Games. So the sense of crisis is now difficult to be conveyed. When you look at how infection spreads, actually we have a lot of evidence. It's not only about eating and drinking. It's not really about infecting the family members. When you meet with the people who you usually do not see, and for the long time, you meet them, and they are a higher risk of the infection. So we know that. However, it hasn't been implemented in every corner of the society. I think that is one of the causes why we are seeing infection spreading. In other countries, people-to-people contact opportunities, in order for them to be decreased, Western countries are imposing the lockdowns. However, in Japan, we cannot really impose lockdown because we do not have laws. We cannot really force people to stay at home. I'm here today, so yes, there are some occasions people have to go out, but when they do, and we know where the risks are high, and number of people is a very important factor, and people who usually do not meet. There's one simulation. So you people, there are family members, there are people you usually see in a smaller team, or if you move to other departments, and when you visit other companies, and we know that there are higher risk of infection. In order to reduce the risk of getting infected, each prefecture can set a number, like 5 or 2. In Western countries, the 10 people is the minimum standard. Whether we go further to like 2, it can be decided by each prefecture. People have a very mixed and complicated feeling. So we have to stand close to those people's feeling when we send out the message. And the place and occasion where risks are higher, we already know that. So if you do this, it is sure that we can decrease the risk of infection. We know that, but they are not necessarily implemented. This is the situation where we are today. Infection is spreading right now from the government, municipalities, and the public and journalists. These are the things we have to be aware of. Otherwise, we cannot right now control the infection, the change of the behaviors. We know that people do not want to do this, but it is true, infection is spreading. So over and over, we have seen where infection can spread. With the support by the people, we can assure you infection can be decreasing. The people, please refrain from meeting the people who you usually do not see. So I would like to highlight the number of people is very important.
Next question, Yamamoto-san from TV Asahi. Yamamoto from TV Asahi. I have a question to Prime Minister. In Western countries, the number of new infection is larger than in Japan, but the patients with severe symptoms and the death is reduced. Therefore, regulations are relaxed. Vaccination is progressing more in Western countries, but in Japan also, in the government, similar trend is observed, and the situation is completely different from in the past. Some people look in that way. Then issuance of the state of emergency and other criteria will be there. And for that, the mindset of the society will have to be changed significantly. As Prime Minister, especially the policy based upon a new number of new cases, are you going to change the policy and the criteria? If so, when, at what timing are you going to send such a message? First of all, the goal of the measure is to protect the life and health of the people, and prevent the people from developing severe symptoms which have strained the medical system. So this policy is important, and medical system locally needs to be protected. As has been mentioned, vaccination is progressing, especially for the people in their 65 years old and higher. We have the progress, the vaccination, and effect is shown. So based upon vaccination, as I mentioned earlier, during the period of state of emergency, by the end of August, up until the end of August, first progress of vaccination campaign, and 40% will be completed 2 doses of vaccination. And the utilization ratio of the hospital bed for the people with severe symptoms and burden on medical system, paying attention to these and conduct specific analysis of the situation and make judgment as to the status of healthcare system, and exit will be considered in a clear manner.
それでは
Otsuka-san from Jiji. This is Otsuka from Gigi. Let me ask about a question to Prime Minister and Dr. Omi. Dr. Omi mentioned lockdown. Lockdown is implemented in Western countries, but we cannot do that in Japan. In the subcommittee, there was a discussion about the lockdown. Prime Minister, how do you see the necessity of the legislation that enables lockdown? Are you going to plan the legislation, and what is Dr. Omi's opinion on that? In European countries and other countries, the lockdown is implemented and people have to pay fines when they flout the message, when they flout the measures. We couldn't see the exit of the crisis. As a result, the vaccine was really the decisive factor. So the lockdown does not really make sense in Japan. We focus on the measures around eating and drinking. This has been the measures that Japan has been taking. In Japan as well, we know that vaccine is effective. As soon as possible and as many people as possible, we would like to have the structure so that we can deliver the vaccines. You mentioned lockdown. As you know, in Japan, compared to Western countries, the measures we have been taken is the very soft measures, and we needed to issue the state of emergency for multiple times. So without legislative or strong law restrictions, without them, we have come here. However, unfortunately, young people haven't vaccinated yet. So it will be increasing. Vaccination rate will be increasing and it will reach young people. Vaccine is not the single solution. So with the vaccination, Prime Minister mentioned this earlier, the tests is the great interest of the many people. Testing capacity has been increased. PCR testing, antigen quantitative testing, compared to the last year, capacity is way more than what we had last year. So if you are feeling sick, or if there are concerns of infection, whether it's workplace, local governments, or the schools, people can take tests. People should take tests without much burden. If we focus on do that, we can do that. This is our hope. And there are efforts being made for medical preparedness. If people and society as a whole has a sense of crisis, we can stem the infection. That is the area we have to put our utmost effort in. Theoretically, we make such a good effort with the vaccination rollout, and people may think it's not enough. Not really a lockdown, but in Japan has been making a request to the public. We have taken strict measures to dining and drinking establishments. I may be oversimplifying, but whether or not we have a legislation where we can receive more support, yes, there are room for the discussion. I think that we are in the midst of the greatest crisis with the vaccine, testing, and with the efforts around medical preparedness. And with one voice message by central and local governments, this may not be still enough. We have exhausted all the measures. And if it is not enough. I'm not. So it's not only about eating and drinking establishments. So a little bit more of the restriction or the stricter measures. Yes, there could be the discussion, and that is actually the discussion that we had in the subcommittee. So it is needed to consider that. So again, the fire has broken out, and it is possible to control the fire, but we expect the discussion for other measures as well.
Nobushiro-san from Bloomberg, please. Nobuhiro from Bloomberg. I would like to ask a question about Taiwan from diplomatic front. After U.S.-Japan summit meeting, in the defense white paper and the discussion from Dietman as well, and reference from Japan. Japan, how is it going to be engaged with the Taiwan situation, and what can be done to prevent contingency? We can expect collaboration with Taiwan for semiconductors. What kind of cooperation are you considering with Taiwan going forward? As Japan, the Japan-China relationship in relation to Taiwan, with the direct dialogue between the straight there's solution should be found. That is a consistent view of Japan. And the Japan-US summit meeting and G7 meeting about Taiwan, such a direction was shown. I'm sure that you know. In that context, the importance of peace and stability of Taiwan relationship, peaceful solution across the strait, that is the conventional stance position of Japan. And as U.S. and G7 countries, the position became very clear amongst these countries. Relationship between Japan and Taiwan, as I mentioned, as non-government working level, practical relationship is to be maintained. Basic position remains unchanged. We protect the national interests of Japan and the deterrence of U.S.-Japan alliance, and like-minded countries of ASEAN. We will be collaborating and working with these countries to respond. That kind of collaboration is important.
はい、それでは読売
The question from Yomiuri, Kuromi from Yomiuri newspaper. Let me ask about when you are going to dissolve the cabinet and election for the lower house. And you have been saying put all out effort to be put into the countermeasures. However, now you have to have a plan for the presidential election of LDP. Are you going to dissolve the cabinet while you are the president of LDP? I have been taking the questions multiple times, and my answer will be the same. We have to control and stem the infection. That is the most important challenge for the cabinet. That remains unchanged. We take several measures, including the vaccination. However, I have a tenure. We will make a comprehensive study. This is the position that I have today.
それでは
Shitakubo-san from 中国新聞, please. Shitakubo from 中国新聞. I have a question to Prime Minister. The movement between the different areas, August 6th in bomb day in Hiroshima, and then 9th of August in Nagasaki, prime ministers attended and expressed determination of peace and had interchange with hibakusha. Are you going to attend these ceremonies? And if you attend, then there will be many people that will accompany you. And what is your view as to anti-COVID-19 measures? And the other day, you have come up with a statement and decision of a black rain. There's great interest on that. And I have a question in relation to that. The aging of the victims is a reason for making political decision on that. 6 years have passed after the filing of the lawsuit, and the decision was prolonged for 6 years. COVID-19 measures and also the development which led to the political decision regarding black rain lawsuit. First, Nagasaki and Hiroshima, and participating and suffering by the people. This should never be repeated again. So only a country which is victim by atomic bomb. And as Prime Minister, I think it is very important from that perspective. Although we are under the state of emergency, there's a request for participating in ceremony. As long as schedule allows, I would like to participate in these ceremonies. On these occasions, minimum necessary people will be coming with me. I would like to minimize the people to go. Also, the ruling of the court this time, I myself, when I was Chief Cabinet Secretary, I was consulted, and from that time onwards, I have been thinking about this. And I have given thorough thought to this. And 84 plaintiffs with the act to support the atomic bomb victims, survivors, based upon the philosophy of the law, we need to give a relief to them. So I made that decision. At the same time, I decided not to appeal to a higher court. First, they are elderly and also some are ill. So to the 84 plaintiffs, provide a certificate as soon as possible. And people under similar situation, I think that they have the similar views. So for these people, prefecture and the mayor, the prefecture and city and the central government will sincerely examine so that we can provide relief. So I have given instructions to that effect.
はい、それでは文化
山本さん from 文化放送。This is Yamamoto from 文化放送。Question to Prime Minister about message and sharing a sense of crisis with the public. In order to make measures more effective, experts including Dr. Omi has been saying that it is important to share the sense of crisis. However, people in Japan said it is okay because the Olympics are going on. And also the fear against the coronavirus has been declining with the vaccination. You sent a message today. Are you confident that you can share the sense of crisis with the public? In order to do that, what is the most important? And also, while the crisis continues, in order to share the sense of crisis, Prime Minister sent in a message in an interview. Are you going to do that? I also want to ask Dr. Omi, as we overcome the crisis, what exactly do we have to do? First of all, to people of Japan, given the current status in each position, it is important for each person to have a sense of crisis. As I said earlier, at the beginning, there was a norm that only elderly people should be careful. Actually, there were a lot of people with severe symptoms. However, the elderly people accounts for less in new cases. People in 40s and 50s, and actually, the 70% of the new cases are actually people who are in the 30s or younger. So it is important to send a message. When we implement measures, yes, the interview, I respond to the interview in very frequent manner. As we do that, we will encourage people to act with the sense of crisis. And we have government PR activities, social media, especially for channel for the young people. We have to focus on those channels to get a message across. You asked how we can share the sense of crisis. I believe there are two aspects. One is the language that we use. In other words, a message. Many people have very complicated feeling. On one hand, we have to take measures against the coronavirus. On the other hand, they want to open and resume economic activities. So we have to stand very close to those people who have mixed feelings. That is kind of the message that we have to convey with the local governments. Language is necessary, but language alone is not sufficient. In order to make it effective, we have to have actions or execution. We are in this kind of the situation. On top of the language, central and local governments or leaders of the government, yes, efforts have been made, but because we are in this kind of the situation, we have to make sure the leaders are making further efforts. I mentioned vaccine, testing, and better medical readiness. Yes, we have been making it more effective. For instance, testing are available in many places, but we are far away from the point test is available anywhere. So the language and action, the combination of the language and action is very important.
So we'd like to limit the questions to the last two questions. Goto-san from TBS, please. Goto from TBS. I have a question to Prime Minister and to Dr. Omi. Information sending of vaccine is a key. Prime Minister came up with a numerical target. 40s and 50s and the younger generation will be vaccinated in the future. And psychological barrier to that is the recognition, the perception about side reactions. There may be fevers and pains are observed in some cases. So to such side reactions, what are the recognition of the government and scientific data and evidence included? Can you please explain about side effects, please? First, side reactions of the vaccine. Regularly, with the expert, we are asking the experts to conduct evaluation. For example, Pfizer's vaccine 18,000 cases have been reported, and those which are recognized as side reactions by experts: fever, and the pain on the area where infection shot is done, and fatigue, sense of fatigue, and headache. And none has impact upon the efficacy of the vaccine. On the other hand, as vaccination progresses, the efficacy and effect becomes very clear. So that many people will be vaccinated, side reactions and effects of the vaccines will be communicated to the people based upon scientific evidence, so that we can request people to be cooperating in being vaccinated. Side reactions of vaccines at a time like this, through internet, series of information are provided. Some of them are not based upon facts. I think it is a fact. So in that context, what is critically important is the effect of vaccine preventing the development of severe symptoms and preventing the onset of the disease. We do have data. So in the news, not only the newspapers and TV, but such information provided through internet as well. Side reactions are to be, information needs to be provided in an open manner. And as a result, although there may be some side reactions, the effects of vaccine is important. As Prime Minister said, considering even young people, there may be development into severe symptoms, and the sequela might happen, and many people do not know that. So at a time like this, it's not just say that in press conference like this, but we use the internet media, and the people who have doubt about vaccines and young people, we talk with them and have dialogue with them, and they will be noticing something new. So repeating such processes, many people will send a message in this way in various fashion. That's important. And together with TV and newspapers, stakeholders, there are people who believe in vaccines and the people who have some doubt about vaccines. There are different types of people. So we will have dialogue with different people, and we have frequent communication with them. And you cannot have face-to-face meeting. So using internet media, we should be communicating the message.
それではジャパンディフェン
Japan Defense Weekly, Takashi-san. This will be the last question. And this is Takashi from Japan Defense Weekly. Prime Minister, during today's press conference, you mentioned the impact of Delta variant and rapid increase of Delta variant, and you said that this is the reason for exponential infection. However, Delta variant in India, in an almost vertical way, Delta variant was increasing in Netherlands and the UK. Even though there have been a lot of vaccine, it increased. In Asia, in Indonesia, there was a vertical increase of the infection. We knew that, but we couldn't stop it. It's not the Delta variant, but it was a lack of simulation and expectation. So the government downplayed the Delta variant. I think that is the increase of infection. What is behind the increase? Under such an optimism, the Tokyo Olympics Games are going on. That is causing infection, I think. You said you, as a responsibility of protecting people's lives and health, you said you want to stem the waves of the virus. If you couldn't do that, if you couldn't protect the lives, that should be protected. Otherwise, do you have a determination to resign from the Prime Minister? About this matter, when we saw the situation in India, border control for the people who are from India and other countries where Delta variants were increasing, the quarantine period was 6 days, but they were extended, and we had a robust border control to check those variants. And the Olympics, there are athletes and stakeholders from overseas. There are separate lanes, so they do not interact with people in Japan. So that is the measures that we are taking. How do you see the determination of resignation? Under my responsibility to respond to the crisis, and this is my responsibility, and I'm confident I can do that. That is the end of the press conference. Those who are raising hands now, you can send your question via email, one question, and the response will be given later, and the answer will be available on the web page. We appreciate your support and understanding. That concludes today's press conference. Thank you for your support and participation.